Today I'm going to talk to you a little bit about our consultation process here at Intentional Self Aesthetics. And really, the consultation is the beginning of our journey together. And in the consultation, I want to accomplish a few different goals when we sit down and talk for the first time. And I'm going to go through these goals one by one, and so that you get a good idea about what to expect when you come in for a consult. One of the first things you're going to do when you come in is you're going to check in at our front desk, and you're going to download our app, which is where all of our key pieces of information about our practice are stored. So a lot of information about our packages and pricing and memberships are in our apps. It's also where all our loyalty points and rewards and other kinds of goodies are held. So be sure to download the app when you come in. Second thing is you download, you're also coming in and checking in at the desk. You give them a form of ID so that we have that. And you're also going to fill out an intake form that has just, demographics, information in it. And so that we have all just data about you. Then you're going to sit and talk with me a little bit, and we're going to have just a general discussion that starts out very broad, and then it'll get a little bit more specific as we go on. I'm going to ask you questions first about your medical history. Do you have any medical issues? I want to get to know really more of a 3D picture of you, who you are as a person. So I ask about medical history. I ask if you've had any surgical history, what other aesthetics procedures you've ever done. A lot of people come to me already having done such things as Botox or fillers. Some people have done a little bit more than that, but I'd like to know what I'm working with in terms of a person's knowledge base. I also ask questions about lifestyle, like who do you live with? What do you drink? Do you smoke? Do you exercise? Are you trying to lose weight? These kinds of things are important because I kind of want to know where your head is at. I want to know what kind of lifestyle you have. Like if you smoke, that impacts your healing. Sometimes if your immune system is kind of suppressed, that also impacts your healing. So I'd like to know some of those, the answers to those questions. I also want to know if you're okay with having your picture taken, because that's a big part of our process too. We like to do before and after pictures. And this is not to post all over Instagram, because I certainly don't post things without my client's permission, but we like to have a photographic record of our journey together and whatever you do here. I also like to assess what your level of commitment is when you come and talk to me in consultation. What is the likelihood that you will follow a plan that we put together? And I just want to have an idea of what kind of level of interest you have. The next thing I'll do is I'll also ask you about your skincare routine, what kind of habits you have, how many times a day you wash your face. Where do you buy your skincare? Do you buy your skincare at the CVS? Do you buy your skincare in a department store, etc.? These are all interesting. These are all questions that I want to have answers to. I also will do a skin analysis by taking a picture of your face in our skin analyzer, and that tells me a lot of information of the condition of your skin. I want to see what level of hydration your skin is in, how clogged your pores are, the depth of your wrinkles, your level of pigmentation, the skin metabolism, all different things that that our skin analyzer will give us the answers to, and we can get a really good picture of what your skin looks like at a subdermal level, and that tells us a lot of information. And our skin analyzer will also make suggestions as to what kind of treatments you would be it would be good for you, and also what kind of skin products would be good for your skin. And we combine the results of your skin analysis with our own clinical analysis, and then we combine that together and we come up with a good treatment plan. But before I get to the treatment plan, I still have more information that I need to gather from you as my client. So more information that I get is, I want to know what your areas of concern are. That's really very, very important to me. I want to know from you what bothers you. I want to know what is your areas of concern. Usually people have like maybe between 2 and 5 areas of concern, ranging from, eyes, very commonly it's eyes, cheeks, neck, tummy, all different kinds of areas. People have areas of concern. If you're talking about body sculpting, it could be tummy, legs, butt, it doesn't matter. There's lots of areas. What is most important is that you tell me what areas concern you. A lot of clients respond when I ask them the question, what concerns you? Clients will respond with, well, what do you think? And they want to know what I think. And what I respond with is, it doesn't matter what I think. I want to know what bothers you. What would you change? Or what do you want to see improved? That's what's really most important, because the bottom line is that you have to look in the mirror every day. I don't have to look at your face in the mirror every day, or your body. So the objective of this consultation is to find a way for you to be happy with you. So this is your time to put everything on your wish list. So these are the kinds of things I want to know. I also want to know what level of tolerance you have. Are you able to tolerate a minimally invasive procedure, or would you rather have something non-invasive? Can you tolerate some downtime? Can you take a day off of work, or forego a day of exercise? Or can you never take a day off of work because you have to be on camera every day? Are you traveling? Do you have any events coming up in the next 1 to 2 months or 1 to 2 weeks? If it's an event that's coming up in a short period of time, we may decide to not do anything within that period of time. We may need to wait until that event is over with before we do anything. So I need to have that knowledge to know what's happening in your life. So once I gather all of that information, and I have those concerns in mind, then I can make some treatment suggestions, and I can formulate a plan for you. And my plan suggestion will usually include options for skincare. So skincare products, usually a regimen of facials, whether it's a hydrofacial or it's clinical facial or it's a chemical peel series. But I do believe that skincare, both products and clinical skincare in the form of facials or peels, do have an impact on whatever actual treatments we do, because it supports our work. And then I do a formulation of treatments. So I take that information that you gave me about invasive versus non-invasive, or downtime versus no downtime, and I make my suggestions based on what will accommodate you and your lifestyle and accomplish your goals in the best way that I know how to give you. So once I do that, then we can map out a timeline of how long that's going to take to accomplish those goals. Usually my philosophy about treatments and treatment plans is such that I like to incorporate a multi-layered approach, meaning that I find that using more than one modality of treatment, whether it's doing a BBL and a RF microneedling, or doing RF M-face and a TIVA, or doing fillers and M-face. Doing multiple things together will give us a great result rather than doing one treatment by itself. So, because different treatments do different things. So one treatment may do skin tightening and one treatment may do fat melting. And so you may want to use both at the same time. And one treatment may address pigment, while another treatment may do a different type of skin tightening procedure. So therefore we want to use them all together so that we have synergy, right? And then synergy always gives us better results. So in summary, the consultation is going to have, yes, a part of like us getting to know each other, seeing that we can work together, but also me getting a better understanding of how I can help you get to you achieving your goals. And that's really what the objective is. And that's all I want to do, is help you get your goals and make you feel better in your skin and have you walk out of here feeling absolutely amazing. So come to Intentional Self Aesthetics and find out for yourself and experience a consultation here with me.